So many people have gone to the hospital thinking they have a heart attack, and it's actually acid reflux. That's why it's called heartburn. You've heard about vitamin C going to the immune system. You've heard about vitamin A going to your eyes. You've heard about calcium going to your bones, and so on and so on. And even if you have a perfect diet, it's very important that what happens here happens. Hi everybody, I'm Dr. Lisa Gordon and I'm at the Natural Health Improvement Center of Columbia, Maryland, where a lot of people come to really handle their health issues. Today we're going to be talking about acid reflux. Acid reflux is such a common digestive problem, and many people come to me frustrated because they really don't want to continue just taking medication if it's not doing the trick. And what I'm going to explain to you today is why it's important that you actually have acid in your stomach. So the way the digestive system works is this. You put food in your mouth, it goes down your esophagus and into your stomach, and then the food gets made into tiny little particles, molecules that can go into the small intestine where nutrients are absorbed into the body, and then your body uses those nutrients for whatever you need them for. You've heard about vitamin C going to the immune system. You've heard about vitamin A going to your eyes. You've heard about calcium going to your bones, and so on and so on. So those nutrients have to come from food in order for your body to understand them and utilize them. That's all well and good, and even if you have a perfect diet, it's very important that what happens here happens. The stomach is actually supposed to be the most acidic part of the entire body. And the reason for that is because when you eat your food and it goes down into your esophagus, it passes through this little valve that opens, this one right here. It goes into your stomach, and the acid is what breaks it down into small enough molecules that the nutrients can be used. So, if you don't have enough acid in your stomach, what do you think will happen? What's going to happen is that the food is not going to be broken down, and therefore you don't have the nutrients to be absorbed into your body in the small intestine. So, where does acid reflux come in? When the body has the right amount of acid in the stomach so that it can break down your food, it does so. That valve is nicely closed, and at the correct level of acidity, in other words, when the stomach contents are acid enough, acidic is the word, enough, only then does this little valve open and allow those contents of the stomach, which come from the food you eat and have been broken down in the stomach with enough acid, to go into the small intestine, and then you can utilize those nutrients. When the stomach doesn't have enough acid, what happens is that these stomach contents actually can go back up into the esophagus. Your stomach is very acidic. It might not be acidic enough. As we get older, this often occurs. Your stomach might not be acidic enough to break down the nutrients or the food that's in there. However, it is acidic enough that if this valve is not closed tightly and that goes back up to the esophagus, it'll hurt because it's quite acidic, even if it's not acidic enough to break down your food. Some medical doctors understand this, and I have wonderful relationships with medical doctors who do understand this. And unfortunately, a lot of medical doctors do what you might have had done, which is to prescribe antacids, acid reducers, proton pump inhibitors, something that causes the acid to be reduced. Well, in a sense, this kind of makes sense because it's acid reflux. It's acid being pushed up into your esophagus, and it is horribly uncomfortable. So many people have gone to the hospital thinking they have a heart attack, and it's actually acid reflux. That's why it's called heartburn. It feels like the heart is burning. You can get pain up into your neck, you can get pain in your back. It feels like a heart attack, and the stomach is here closer on the left side near the heart, so it feels like a heart attack. So many times it's actually acid reflux. So if you take an acid reducer and reduce the thing that's in your stomach that you require to break down your food so you can use the nutrients in your vegetables and in your fruits and in your meats and in your good quality carbohydrates and in the things that you actually need to use in your body, if you can't break those down and instead they're just sitting in there and this valve is not opening, you're going to get acid reflux, you're not going to use your nutrients, and you may end up becoming malnourished. This is a really big concern. Acid reducing medications are meant to be used for a maximum of 6 to 8 weeks. I cannot tell you how many of my patients have come in here and have told me, I've been on them for 6 years, 12 years. If you even read the insert of the medication, it tells you don't use them that way. So that's something that I'm very, very concerned about. And those people have all sorts of other health concerns because they're essentially not getting their nutrients. So if you don't have enough acid in your stomach to digest your food, would it make sense to see if that person might need a little more acid in their stomach? We have supplements and we test them. So I am not guessing about any of these things on any of my patients. Every single one of my patients who I sell any supplement to has been tested in my office with a non-invasive technique that's unique to each person. The result is unique to each person. I use muscle testing, and the muscle testing is very accurate. So I can find out, is this person in need of enzymes only maybe? Or is this person in need of enzymes plus acid? Or if is this person in need of just hydrochloric acid to increase the ability of their stomach to digest the food and then allow this valve to open at the correct level of acidity to go down into the small intestine and utilize those nutrients, having them go everywhere. Okay, so we need to correct the acidity level of the stomach. We can also have a completely different problem that is often associated with reduced acid in the stomach, and sometimes it isn't associated with that. Sometimes this valve right here is a little floppy. So that can get kind of just open and shut, but not well. It doesn't really just clamp shut like it's supposed to when the stomach is doing its acid breaking down of food. So it can kind of get a little floppy, and then the acid in the stomach, if it's the correct amount of acid or the not correct amount of acid, that acid can kind of go up into the esophagus. This is handled in a different way from using nutritional supplements. Sometimes, often, we need to do both. This is called a hiatal hernia. Sometimes the stomach, and I'm going to use my hands to show you, it's kind of like plumbing. So here's the esophagus, and the stomach kind of just clamps right in it like plumbing. That valve is supposed to clamp down on the top of the stomach and close very tightly, so that the stomach can churn and do its thing and nothing comes up. If that valve is floppy, it's almost like the stomach is going up into the esophagus a little bit. And so with this wonderful chiropractic technique called a hiatal hernia reflex technique, we can gently pull the stomach out of the esophagus and allow that valve to close properly. So that's something that I do on people all the time. It's a little more complex than that, and there's a 4-part technique that I use on my patients very regularly, because this is common. It can occur when people are a little bit overweight. It can occur when people have had babies. It can occur when there are any number of things going on in the body. So it's a very effective technique that I check on every patient when they're in the office at some point during my relationship with them, and especially if they tell me they're having trouble with digestion or acid reflux. I always check this to see if it might be a structural issue in addition to or instead of an acid issue. So what I'd like to tell you is that acid reflux is not necessary to suffer with. And if you watch another one of my videos that is a chiropractic adjusting video and on my nutrition response testing video, you will see me doing some of these techniques, and it's very, very important. Food is our most important medicine. And what we need to do is have a good digestive system so that we can digest our food. We choose good foods, we have a healthy digestive system, and there's so much more to it, but this is one really important piece. If you struggle with acid reflux, or if you suspect that you might have acid reflux, or if you know somebody who has acid reflux, please do comment below this video, and I'll do everything I can to help you to either find a practitioner in your area who can help you, or if you're in my area, please do give us a call. I'm here to help you. Share the video. I would be happy to help you.